Hello everyone, and welcome back to my channel. I'm Dr. Sarah Mitchell, your trusted urologist, and today we're diving into something that could literally transform your prostate health and overall quality of life. If you're over 60, I want you to pay very close attention to what I'm about to share with you, because what I'm going to reveal today challenges everything you've been told about exercise and prostate health. You see, most men your age have been told that walking is the best exercise for maintaining health. And while walking is good, it's not enough for optimal prostate function. In fact, there are 5 specific exercises that are scientifically proven to be far more effective for supporting your prostate health, improving urinary function, and enhancing your overall vitality. Before we dive in, I need you to do 3 things for me. First, hit that subscribe button and ring the notification bell, because the information I share on this channel has helped thousands of men reclaim their confidence and health. Second, drop a comment below telling me your biggest prostate health concern. I read every single comment and often create videos based on your questions. And third, make sure to check the link in the first comment and in the description below. I've personally vetted a natural prostate support supplement that works incredibly well alongside these exercises. Now, let's get started with information that could change your life. Here's what most doctors won't tell you about walking and prostate health. While walking is excellent for cardiovascular health and general fitness, it doesn't specifically target the muscle groups and circulation patterns that directly impact your prostate. Think about it this way. Your prostate is a walnut-sized gland that sits deep in your pelvis, surrounded by a complex network of muscles, blood vessels, and nerves. Walking primarily engages your large muscle groups, your legs, glutes, and core to some extent. But it doesn't specifically address the pelvic floor muscles that directly support your prostate. Research published in the Journal of Urology shows that men who perform targeted pelvic exercises experience up to 40% improvement in urinary symptoms compared to those who only walk. That's a massive difference. But here's the kicker. Most men over 60 have weakened pelvic floor muscles due to years of sitting, stress, and natural aging. Walking doesn't strengthen these crucial muscles. In fact, if you have poor posture while walking, you might even be putting additional strain on your pelvic region. That's why today, I'm going to teach you 5 targeted exercises that address the root causes of prostate issues, not just the symptoms. Exercise number 1 is the foundation of prostate health, proper pelvic floor strengthening, also known as Kegel exercises. But I'm going to teach you the advanced version that most men don't know about. First, let me explain what we're targeting. Your pelvic floor is like a hammock of muscles that supports your bladder, prostate, and rectum. When these muscles are strong, they improve blood flow to your prostate, enhance urinary control, and can even improve sexual function. Here's how to do it correctly. Sit comfortably with your feet flat on the floor. Now, imagine you're trying to stop the flow of urine midstream. That's your pelvic floor contracting. But here's the key that most people miss. You also want to gently lift these muscles upward, as if you're lifting a marble with your pelvic muscles. Contract for 5 seconds while breathing normally. Don't hold your breath. Then relax for 5 seconds. The advanced version involves 3 different intensities. Start with a gentle squeeze for 10 repetitions, then medium intensity for 10 reps, and finally, maximum contraction for 10 reps. Common mistakes to avoid. Don't squeeze your buttocks, don't hold your breath, and don't bear down. You should feel the muscles lifting up and in, not pushing down. Studies show that men who perform these exercises correctly for 8 weeks see significant improvements in urinary flow, reduced nighttime urination, and better prostate health markers. One study found that 75% of men experienced noticeable improvement within just 6 weeks. I recommend doing this exercise 3 times daily, morning, afternoon, and evening. It only takes 5 minutes each time, but the results are profound. Exercise number 2 might surprise you, deep squats. But these aren't your typical gym squats. These are specifically designed to improve circulation to your pelvic region and strengthen the muscles that support your prostate. When you perform a deep squat correctly, you're creating a powerful pump mechanism that increases blood flow to your entire pelvic region. This enhanced circulation delivers vital nutrients to your prostate and helps remove metabolic waste products that can contribute to inflammation. Here's the proper technique. Stand with your feet slightly wider than shoulder width apart, toes pointing slightly outward. Place your hands on your hips or extend them forward for balance. Now, slowly lower yourself down as if you're sitting back into a chair, keeping your chest up and your weight on your heels. Here's the key difference. Go as deep as your mobility allows, ideally until your hip crease is below your knee level. Hold this position for 2 to 3 seconds, then slowly rise back up. The slow, controlled movement is crucial for maximizing the circulation benefits. If you can't go that deep initially, don't worry. Use a chair behind you for support or hold onto a door frame. The goal is gradual improvement, not perfection from day one. As you get stronger, you can add variations. Pulse squats at the bottom position, single leg squats, or holding light weights. But remember, the focus is on depth and control, not speed or heavy weight. Research from the International Journal of Men's Health shows that men who incorporate deep squatting movements into their routine have 30% better prostate blood flow compared to sedentary men. This improved circulation is directly linked to better prostate function and reduced symptoms. Start with 2 sets of 8 to 10 repetitions 3 times per week. Focus on perfect form rather than quantity. As you improve, you can increase to 3 sets of 15 repetitions. Exercise number 3 addresses a hidden culprit behind many prostate issues: tight hip flexors. Most men over 60 have chronically tight hip flexors from years of sitting, and this creates a cascade of problems for prostate health. When your hip flexors are tight, they pull on your pelvis, creating tension throughout your entire pelvic region. This tension restricts blood flow, compresses nerves, and can even affect the position of your prostate within the pelvis. The most effective stretch is the couch stretch. Kneel on the floor with one foot forward in a lunge position. Place your back foot up on a couch or chair behind you. Now gently push your hips forward while keeping your torso upright. You should feel a deep stretch in the front of your hip and thigh. Hold this position for 60-90 seconds on each side. Breathe deeply and try to relax into the stretch. Don't bounce or force it. Gentle, sustained pressure is what creates lasting change. Another excellent variation is the standing hip flexor stretch. Step one foot back into a lunge position, then gently push your hips forward while raising the arm on the same side as your back leg. This creates a full body stretch that releases tension from your hip all the way up to your rib cage. When you release hip flexor tension, you immediately improve the positioning of your pelvis, which takes pressure off your prostate. Many of my patients report improved urinary flow and reduced pelvic discomfort within just a few weeks of consistent stretching. Perform these stretches daily, preferably in the evening when your muscles are warm. Each stretch should be held for at least 60 seconds to create lasting change in muscle length. You'll know it's working when you can sit more comfortably, your posture improves naturally, and you feel less tension in your lower back and pelvis. Exercise number 4 is core stabilization through modified planks. But these aren't the planks you might know. These are specifically designed to strengthen your deep core muscles while supporting optimal prostate health. Your core muscles work intimately with your pelvic floor muscles. When your core is weak, your pelvic floor has to work overtime, leading to dysfunction and symptoms. A strong, stable core takes pressure off your pelvic floor and allows it to function optimally. Start in a standard plank position, forearms on the ground, body in a straight line from head to heels. But here's the modification. While holding the plank, gently engage your pelvic floor muscles as if you're doing a Kegel exercise. This creates what we call 360-degree core stability. Breathe normally while maintaining the plank and pelvic floor engagement. This is challenging at first, but it's incredibly effective for building functional strength that translates to better prostate support. Start with 20 to 30 second holds, focusing on perfect form. As you get stronger, you can progress to side planks, single arm planks, or plank variations with leg movements. But always maintain that pelvic floor engagement. One of my favorite variations is the breathing plank. Hold a standard plank position, then take a deep breath in, allowing your belly to expand slightly. As you exhale, gently draw your navel toward your spine and engage your pelvic floor. This creates a powerful strengthening effect for all the muscles that support your prostate. Studies show that men with stronger core muscles have significantly better urinary control and less prostate-related discomfort. The connection between core strength and pelvic health is undeniable. Perform planks 4 or 5 times per week, starting with 3 sets of 20 to 30 seconds. Focus on quality over quantity. A perfect 20-second plank is better than a sloppy 60-second hold. Exercise number 5 is resistance band training, specifically targeting the muscles that directly impact prostate health. Resistance bands are perfect for men over 60 because they provide variable resistance that's easier on joints while still building functional strength. Lie on your side with a resistance band around your knees. Keep your feet together and open your top knee against the resistance of the band. This exercise specifically targets the deep hip rotators that help stabilize your pelvis and support optimal prostate positioning. Lie on your back with the band around your knees. Perform a bridge by lifting your hips while simultaneously pushing your knees apart against the band resistance. This combines glute strengthening with hip stabilization, a powerful combination for prostate health. Place the band around your knees and perform squats while maintaining tension in the band. This forces your hip stabilizers to work harder and improves the functional strength of your entire pelvic region. Resistance bands provide accommodating resistance, meaning the tension increases as you stretch the band. This creates a unique strengthening curve that's particularly beneficial for the smaller, stabilizing muscles around your pelvis. Perform 2 to 3 sets of 12 to 15 repetitions for each exercise 3 times per week. Use a band with moderate resistance. You should feel challenged but able to maintain perfect form throughout all repetitions. As you get stronger, you can use bands with higher resistance or combine multiple bands for increased challenge. The key is consistent progression while maintaining perfect form. Now that you know the 5 exercises, let me show you how to combine them into a weekly routine that maximizes results while fitting into your busy schedule. Here's my recommended weekly structure. Monday, Wednesday, and Friday focus on strength exercises, pelvic floor strengthening, squats, planks, and resistance band work. Tuesday, Thursday, and Saturday are dedicated to mobility, hip flexor stretches, and gentle movement. Sunday is your rest day. Each workout session should take only 15-20 minutes. Start with 2 to 3 minutes of gentle movement to warm up, then perform your exercises in circuit fashion. For example, 1 set of pelvic floor exercises, followed immediately by squats, then planks, then resistance band work. Rest 1 to 2 minutes and repeat for 2-3 total circuits. If you're just starting out, begin with every other day and focus on learning proper form. If you're more advanced, you can add additional sets or more challenging variations. The key is consistent progression without overexertion. Keep a simple log of your exercises and how you feel. Many men notice improvements in urinary symptoms within 2 to 3 weeks, with more significant changes occurring after 6 to 8 weeks of consistent practice. These exercises complement walking beautifully. You can still maintain your walking routine. In fact, I encourage it. But now you'll have targeted exercises that specifically address your prostate health needs. Before we wrap up, let me share the most common mistakes I see men make with these exercises. Avoiding these pitfalls will dramatically improve your results. Mistake number 1 is rushing through the movements. These exercises are about quality, not quantity. Slow, controlled movements with proper form will give you far better results than fast, sloppy repetitions. Mistake number 2 is inconsistency. Doing these exercises once or twice a week won't give you the results you want. Your muscles need consistent stimulation to adapt and strengthen. Aim for at least 4 or 5 days per week. Mistake number 3 is holding your breath during exercises. Proper breathing is crucial for pelvic floor function. Always breathe normally and use your breath to enhance the exercises, not fight against them. Mistake number 4 is expecting overnight results. While some men notice improvements quickly, significant changes typically take 6 to 8 weeks of consistent practice. Be patient and trust the process. Mistake number 5 is exercising through pain. These exercises should never cause pain. If you experience discomfort, modify the exercise or consult with a healthcare professional. While these exercises are incredibly effective for maintaining and improving prostate health, it's important to know when professional medical evaluation is necessary. You should consult a urologist if you experience blood in your urine, severe pain during urination, complete inability to urinate, significant changes in urinary frequency or urgency, or any symptoms that worsen despite consistent exercise. Even if you're feeling great, men over 60 should have regular prostate screenings. These exercises are preventive and supportive, but they don't replace proper medical monitoring. The best approach to prostate health combines targeted exercise, proper nutrition, stress management, and regular medical care. Think of these exercises as one important piece of a comprehensive health strategy. Gentlemen, you now have 5 powerful exercises that can transform your prostate health and overall quality of life. But knowledge without action is worthless. I challenge you to start implementing these exercises today. Not tomorrow, not next week, but today. Remember, your prostate health is in your hands. These exercises, when performed consistently, can help you maintain the vitality and confidence you deserve well into your golden years. If this video has been helpful, please hit that like button and subscribe to my channel. Your support helps me continue creating content that can change lives. And don't forget to ring that notification bell so you never miss my latest prostate health tips. I want to hear from you. Drop a comment below and let me know. Which of these 5 exercises are you most excited to try? Or if you've been dealing with prostate issues, what's your biggest concern? I read every comment and often create videos based on your questions. Before you go, make sure to check the link in the first comment and in the description below. I've personally researched and vetted a natural prostate support supplement that works synergistically with these exercises. Many of my patients have seen even better results when combining targeted exercise with proper nutritional support. Remember, age is just a number, and with the right knowledge and consistent action, you can maintain optimal prostate health for years to come. Take control of your health today, and I'll see you in the next video. Until next time, this is Dr. Sarah Mitchell, reminding you that your best health is always within reach. Take care. While these exercises are incredibly effective for maintaining and improving prostate health, it's important to know when professional medical evaluation is necessary. You should consult a urologist if you experience blood in your urine, severe pain during urination, complete inability to urinate, significant changes in urinary frequency or urgency, or any symptoms that worsen despite consistent exercise. Even if you're feeling great, men over 60 should have regular prostate screenings. These exercises are preventive and supportive, but they don't replace proper medical monitoring. The best approach to prostate health combines targeted exercise, proper nutrition, stress management, and regular medical care. Think of these exercises as one important piece of a comprehensive health strategy.